What are the 5 commonest causes of sudden death in Nigeria or in the world? Now, sudden deaths are very common now due to an increased prevalence of predisposing diseases and conditions. So, what is sudden death? Well, most of the sudden deaths are caused by unnatural events like accidents, road traffic accidents, um, drownings, fire accidents, and all that. But that is not what we are concerned with today. Today, we are talking about the 5 common natural causes of death, of sudden death. Now, by definition, sudden death refers to an unexpected, sudden and unexpected uh, event that leads to sudden fatality or death in a previously apparently healthy person. So this person will usually be very healthy, will be walking around, doing his normal activities, okay, and then he will suddenly fall down and die within a short time. Now this is common amongst athletes that sometimes die in the pitch of play. Then another definition or another aspect of this sudden death is that the patient or the person may have a previously existing morbidity that is not expected to result in immediate fatality. So the man may have a pre-existing heart disease, he may have some hypertension, he may have some diabetes, which most people will live with for years, but then suddenly there's a fatal outcome. So it's not all people who have sudden deaths that are apparently healthy. Some of them have some pre-existing condition that is not expected to result in immediate fatality. Now, sudden death usually causes a severe grief reaction amongst relatives and friends because the person who has been previously active, healthy, usually maybe in the prime of his life, and who is maybe the breadwinner of the family, suddenly drops dead. And this causes a lot of grief reaction, disbelief, and disbelief, and sometimes disbelief, and sometimes depression. Okay, so that's the reaction that people get from these sudden deaths. And sudden deaths are commoner in men above 60 years, but more and more now it is being seen in younger people. Now, what are the causes of sudden death? Most, and if not all, of the causes of sudden death are related to the heart, the blood vessels, and the brain. So those are the 3 things that usually something goes wrong in one of these 3 systems. So it suddenly goes wrong in one of these systems can result in sudden death. So what are the 5 causes? Let's go through them one by one. The first cause is, one of the causes is irregular heartbeat, which is called arrhythmias. Okay, irregular heartbeat, which is called arrhythmias. The second cause is acute myocardial infarction, or what the layman will call heart attack. In this condition, what happens is that suddenly the blood flow to parts of the heart becomes disrupted, and that portion of the heart may die and result in the heart not pumping very well again. The third most common cause of sudden death is a massive stroke, and that usually happens when when either blood supply is cut off to a certain portion of the brain, or if the person has a small aneurysm in the brain, what is called a small balloon-like swelling of the blood vessels in the brain. When it blows up and it begins to bleed into the substance of the brain, so it's called a hemorrhagic stroke. But when there's a blockage from a clot, it results in an ischemic event that causes, when it is massive enough, or when it occurs in critical areas that are responsible for the vital functions of the body, the person can die suddenly. Now, the fourth cause of sudden death is acute pulmonary embolism. Now, acute pulmonary embolism means that a clot forms in the heart and goes into the blood vessels the pulmonary arteries which supply blood to the lungs, and that clot blocks the pulmonary artery. And when it does that, blood no longer gets to the lungs, and therefore the lung collapses. Now, if it happens in a small part of the lung, it is survivable. But when it is massive, particularly if there's a type of embolism that is called a saddle embolus. In a saddle embolus, the blood vessel is blocked by a huge clot that sits at where the arteries bifurcate. And when that happens, you are said to have a massive pulmonary embolism. Of course, the last case is what is called an aortic catastrophe. Now, the aorta is the main blood vessel, the huge blood vessel that takes blood from the heart before it distributes to smaller blood vessels. So sometimes, due to hypertension, or in those days due to syphilis, or due to atherosclerosis, the blood vessels, the blood vessels of the wall of the aorta begins to weaken, and it begins to crack. And in such situations, it may just blow out, and blood will leak out massively, and the person becomes exsanguinated and dies immediately. Now, in the case of aortic aneurysm, it can occur, such a catastrophic aortic event can occur without any warning. But most of the time, it is preceded by days, if not weeks, of excruciating pain in the chest. Very, very excruciating pain, the pain of aortic dissection. Now, if somebody notices this pain and goes to the hospital on time, the life-saving measures can be adopted before the aorta actually ruptures. Now, what do you do as a layman to make sure that people survive these 5 events that usually result in sudden death? The first thing is prevention, long-term prevention, by treating your hypertension, making sure that the blood vessels you are treating your hypertension very well, so that it reduces the risk of them of having a hemorrhagic stroke. By treating your diabetes and any other pre-existing condition, you make sure they are well treated. But once such a fatal event happens, time is critical, and what is important at that moment is to try to revive the patient or keep the patient alive until they can reach the hospital. And the 2 critical things that you can do is mouth-to-mouth resuscitation to help oxygenation, and chest compression. Okay, that was the process of cardiopulmonary resuscitation. And while you await for the auxiliary workers, okay, to come and commence resuscitation. And once they arrive at the scene, they will take over and maybe put the man on oxygen, intubate the patient and breathe for him, and start emergency CPR. And if they find out that he has irregular heartbeat or arrhythmias, what they'll simply do is they might attempt to do a defibrillation of the heart. So thank you very much. Once again, the 5 of the most common causes of sudden death are: 1, irregular heart rate or arrhythmias; 2, myocardial infarction or heart attack; 3, pulmonary embolism; 4, massive stroke; and 5, an acute catastrophic aortic event. Thank you very much. Please subscribe to this channel and like the video, subscribe to the channel, hit the notification bell, so that if each time I post a new video, you can benefit from it. And please comment. Your comments are invited. Comments can be critical, but they shouldn't be. The usual rules of commentary on this kind of events should be followed. Thank you very much.